So, and welcome to counseling. I am a mandated reporter, so anything that you say about any types of physical violence or past transgressions involving any level of sexual abuse, physical abuse, things like that, I will have to report that. I figure I should let you know that before we get started. But this is a safe place, and you are open and free to talk about anything you'd like. So, what brings you in today?
I just got charged with a DUI. I am struggling at work. They really want to let me go, but I think they're going to give me another chance if I go through some type of program and get counseling. So I definitely have a drinking problem, which, stems from just the stress level in my life and my boyfriend leaving me and, everything else that's going on. So that's why I'm here.
That's a lot. It sounds tough.
It is. I don't know. I feel like alcohol is the only way that I can get through a day.
So you're using it mostly as a coping mechanism?
Yeah, I drink every single day, even before work, just to get me through the day.
And work, and it's not like any level of court mandated thing that you're here? They suggested it, or are you being...
Yeah, it's through work and the court, and it's a combination of both that they want me here.
How does that make you feel?
Frustrated and resistant. I don't want to be here because I don't know. I don't feel like my problem is that bad, but apparently everyone else does.
That's understandable. So would you say, when it comes down to it, that your drinking has led to the problems at work, or you think it's at a point where you're able to control it and it shouldn't be that big of an issue?
I feel like, I don't know, I feel like it's just a way of my life. Like, it just makes me feel better to forget everything. So I don't think it's, I don't know.
So I think what I'm hearing you say is that you feel it's not as big of an issue as the work and the courts are making it out to be. Is that correct?
Yes, I
And since you're being forced into this type of setting, may I ask your level of willingness to participate in counseling?
I'm willing. I'm here.
Do you think counseling would be able to offer you a level of tools that would help on really any level to see if you can't progress in a more positive manner to, for lack of a better term, keep the people at work off your back?
Yeah, I mean, I'm open to it. I just, I don't know how my schedule's gonna be able, for me to be able to do this, so we'll see. I'm here right now, so.
Okay. So, and you're aware that, it's a 21-day program, and we bring you in, and your schedule with work, that they and the courts have agreed with us that we will work it out with you for the PHP. You'll basically come in and take the group counseling, and you'll have an individual counselor that you'll see. So like all of that worked in with your scheduling seems to be something that's feasible for you, yes?
Yeah, I mean, I guess I don't really feel like I have a choice, so I am going to do what they're saying for me to do.
Okay. So upon your initial intake, we'll definitely give you orientation, and we'll make sure that you have all the information that's necessary. You'll have a list for everything and all the psychoeducational courses as it goes on through your group therapy, and then with individual counseling, I'll be your counselor. And we can talk about, like I said, any variety of things, things that might trigger you, things that you feel you may need to work on when it comes to perhaps, let's say, the stressors, as you call it. So if you want to, like we get started there, and as we progress and we learn more about each other, we'll begin to develop a rapport. And the more I learn about you, the more I'll be able to be of assistance with a lot of these things. So what does a typical day look like for you from basically sun up to sundown?
Well, I usually get up and I go straight to the liquor cabinet, and instead of just orange juice for breakfast, I have orange juice and vodka. And I start my day off like that and go to work, and I'm an accountant, so nobody, I'm in this cubicle all day and I don't talk to really anybody that much, and I keep to myself, so I feel like nobody can, and vodka you can't really smell on your breath, so nobody really knows that I'm drinking, and so that is all throughout work. And then I get home after work and I just decide that I don't like to be alone in my house, and I don't like being alone at all, and so I go out to the bar, and I just decide that I'll drink more, and I just hang out at the bar all day, and then I'm pretty lit until I go home. And if somebody comes with me, that's great. If somebody doesn't, well, then at least I've put myself to the point where I pass out. And then I wake up and start all over.
Do you generally find that you need the alcohol to help you fall asleep at night?
Well, this was just recently, since my boyfriend left me, that I've been going out to the thing. But yeah, I just feel like it's a great escape. It makes me feel good. I feel amazing and don't have to think about anything else. And I just feel free.
Gotcha. So would you say that since your boyfriend left, that's been the main trigger for going out at night and continuing to drink?
I feel like lately it's just added on to everything.
With the job and the
Yeah.
isolation of the cubicle and
Yeah.
just the stress from
Just
all that.
everything.
Yeah.
And now with the DUI, I don't know. Just feels like one more thing to add to the list.
Right. Yeah, it can be a lot. Totally get that. So when I sit here and I look at everything that you told me, it sounds to me like you're saying, even upon waking up, you feel as though you need the drink. Is that correct?
Yeah. I get shaky. I start feeling nauseous, and I get clammy and cold and hot. It is I keep going through these flashes, and I feel awful. But once I start drinking my little screwdriver, I feel better, and everything goes back to feeling better.
And you feel like as you drink throughout the day, it helps to carry you through the day?
Yeah, I'm feeling on top of the world.
And then once you leave work and you continue that process, you feel like that continues to help you to move through the emotional pain from him being here?
Yeah, I just feel like I can forget him, I can forget being alone, and I can just not feel, in a sense, but also feel at the same time.
Makes sense. So, when it comes down to it, have you ever tried any of the 12-step programs outside of any of this level of therapy?
I have not.
No?
No.
Do you feel like when you leave here, that would be something we could set up for you as an advocate? Sorry, those clients get rowdy.
I definitely think that I will consider it, but I don't know how I feel yet.
Okay, well, like I said, we have 21 days to get through all this. One of the main purposes of the course is to give you some tools and coping mechanisms to deal with your drinking. So after running through like the average day and hearing how everything goes for you, would you say that the isolation at work and sitting in that cubicle and not having anyone around adds to the feelings of loneliness and compels you to drink more?
Yeah, absolutely. Like, it's a horrible feeling to feel alone, and it makes you feel scared, and it makes you not want to be here, and I don't like feeling like that.
Okay. So one thing I'd like to touch on is that you said you feel like you don't want to be here. Does that just mean like a level of depression where maybe you'd prefer to stay in bed all day type feeling? Or, and again, I'm a mandated reporter. Does that mean like, you know, you feel like you might want to hurt yourself or someone else?
I don't know if I've ever gotten to that point.
Okay.
I feel like maybe the thought has crossed my mind, but it wouldn't be something I actually went through with.
Gotcha. Yeah, a lot of times in life things get difficult, and when it comes down to it, we tend to shut down when we're faced with some of these situations. Me, myself, I've actually had experiences like that, and the tools that I learned in counseling and in therapy were very valuable. That's actually why I'm in this field. So I can relate a lot to what it is that you're going through. However, when it comes to using the alcohol to numb yourself to the feelings of loneliness and you know, these types of depression, do you feel as though this is a solution that you could keep up with for essentially the rest of your life?
I don't know. I feel like that feels overwhelming to me.
So you kind of just take it one day at a time?
Yeah, I think that being able to just think about today is better for me.
Gotcha. So would you say that the issues with work, you know, the boyfriend leaving, and these other emotions that you've expressed, these would be probably the main triggers, main cores to the reasons why you drink?
Yeah, I just feel like I don't have any other way. That's what I feel like. I don't have any other way to cope with these things. And, you know, I think because I am a child of seeing that behavior in my parents and watching them go through it, I always thought I would never do it myself. But here I am, drinking every day, and I know that that makes me more susceptible, but I don't feel like, I don't know, I always thought that I wouldn't be, sorry, I would not be this person that I am today. This is not who I envisioned for myself, but here I am, and I just don't know. I don't feel like it's that bad, but apparently driving while drinking is not that great. So
would you say on any level that your drinking has made your life unmanageable?
right now, I guess me getting the DUI or DWI is unmanageable, but because I got caught. But it just keeps me, I feel like it keeps me alive. Like the alcohol just keeps me alive and keeps me in a state of being where I don't have to deal with anything and I can just be free.
Gotcha. So, when it comes down to it, some of the things that we're going to cover in our groups is basically the coping tools. And one of the things that I feel that are a good coping tool for these types of things is having a type of a hobby or a way to express yourself, sometimes emotionally, through music or art. Would that be something you'd be opening to?
Yeah, I do love music, so I think if that is something that you guys
So, another thing that I'd like to point out is that, so like in order for all this to work, I would strongly suggest that you possess a certain level of willingness, because it sounds to me you got a lot going on, and that's really tough. It sounds really, really tough, and I know that life can get just hard to handle at times, especially when you have a job where you're isolated alone in a cubicle, and then the person that you have a future with ends up, disappearing. Like, these things are just big stressors. Yeah. And when certain life changes happen, we basically end up trying to cope in unhealthy ways sometimes. And it sounds to me like what you're saying is that these types of things have made a certain level of unmanageability, not just with your work life, but with your personal life as far as the driving issue. So, now you're here, and, again, it'll be 3 weeks, 21 days, where you'll have the groups, and we're going to give you a whole valuable list of tools and other things, coping mechanisms. The mindfulness, the meditation, are just some of the groups. We do the art therapy, we do music. Some of these things will actually help you to discover not just parts of yourself, but parts of ways of dealing with these stressors in these lonely times. So when it comes down to it, we'll provide you with these tools, we'll provide counseling, we'll provide aftercare, and once we get a little further along here, like I said, we'll develop more of a relationship, and things will go really well. It's only been 17 minutes. So, what are some other things that you like to do? Aside from the drinking, is there a time that you can remember when you had a good time without drinking?
A good time without drinking was probably when my friends and I would go around at night driving and just listening to music. But then after my mom died, I think that's when I started drinking. So I feel like all those good feelings of going out with my friends, they just ended.
So what I'm hearing is music has been a common theme for a feel-good in your life. Yeah. And it sounds like that's something that you can relate to on a head level. Yeah. Okay.
I feel like maybe getting back to that, maybe that moment of just unwinding and not really having a care in the world, but listening to music and being in the moment like that would help.
Okay. How old were you when your mother passed away?
I was probably like, I don't know, around 17.
Do you mind me asking how she passed?
She had a drug overdose. She was, addicted to pills and alcohol, and decided that I guess she needed more than her body needed, and she didn't wake up. So.
And how did that affect you as a 17-year-old?
Yeah, that messed me up pretty bad. I was living with her at the time, so my parents are split up, so I had to move in with my dad and a whole new family, and I feel like being with somebody that was never around in my childhood, and then having to be thrown into that, and losing my mom, who was, as much as she was crazy and drugged out and alcoholic, she was my everything. So I lost someone so important in my life and was pushed into a situation that kind of just broke me, and I feel like I died a little that time. too.
So the transition with moving in with your father, that must have been difficult.
Yeah.
Can you tell me a little about that?
Well, he was super strict, and he was more focused on the family that he had created when I wasn't around, and it made me feel like I was not. I was not the person or important in his life, so I feel like since I had to get out of there as soon as I could, so when I turned 18 I moved out, and I got my own place with some friends, and started drinking a lot then, and kind of just continued down that path of drinking.
So what I'm hearing you say is that early on in life, the car, music, friends, driving around, good times.
Yeah.
And then as the events unfolded with your mother passing and this transition in your life, that's when the drinking really picked up.
Yeah, I feel like that's definitely the way I could function.
And then as life progressed, you and your boyfriend.
Yep, thought he was the love of my life, and he decided that he didn't want to be with me anymore, and that just crushed me again, because here I am all alone, and I have no one in my life.
And then after that, the drinking got progressively worse.
The drinking.
To the point where your job noticed.
And now, because of the DUI, my job knows, everybody knows, and I am where I'm at today.
So it would seem to me that loss and just all around the frustration of work, from what I gather from everything you told me, are like two of the biggest triggers: the loss, and the loneliness, and the frustration of work. Those are the biggest reasons why the drinking continues and gets progressively worse.
Exactly. I'm alone.
And what do you think might be some of your, just off the top of your head, like coping mechanisms that you would come up with to kind of combat your drinking, to make it a little less prominent in your life?
Well, I really liked what you said before about having the music aspect of, helping me. So I think that I'd like to focus on that. And, maybe the group counseling would help as well, since I'm so alone, and not, having other people around might feel good. I just think that, being here right now, I feel like you are concerned. You seem very genuine, so I feel like this is really helpful, to not feel alone.
So when it comes down to it, I'm not really supposed to disclose too much about myself, but one thing I do tell most of the clients is that I have a history of alcohol and drug abuse. I chose this path because I literally live to serve, and I love helping people. My goal at the end of the day is to have you guys be better and essentially put me out of business. Because if everybody can stay clean and sober, I don't have a job. I realize that's unrealistic, but I like having an unrealistic dream. So that's the main reason why I came to college and came to school to do this, to have this role to help others that have gone through what I went through. I also lost my father at a young age. It was also due to drugs. And there's just literally been a lot that I myself have gone through that led me to come to do this. But when it comes down to it, I didn't have the tools of counseling. I didn't have therapy sessions. I didn't have any of those things. And this continued through my 30s up till now. years of my life that I've gotten clean and sober. And it's taken a lot of work for me to get here. And the reason I say all that is because nothing in life worth doing is ever easy. I often tell the clients that I have great faith in them because I do. Because within each of us is someone that just wants the love and acceptance, someone that just wants to be heard. And a lot of times, the loneliness that you describe is actually what a lot of us are going through. I myself can relate to that. So when we have the groups and we do the different types of therapy and we have these different tools that we help you discover, a lot of times coping with that loneliness is an invaluable tool. I myself have been alone for the last 6 months, and it is such a joy to sit down and prepare a meal that I actually want. I don't have to consider someone else. I take myself on dates. I go on with, I have to take myself to dinner, to the movies. I stay up late watching TV and eating ice cream if I want. For me, I've learned to be comfortable with myself without a substance. And that's just me. And I know everybody's not me. And what works for me might not necessarily work for you. But the purpose of the groups and the purpose of the counseling is to take the time to figure out who Tina is and what Tina likes. And the coping mechanisms that we can begin to develop to actually help you carry on through your journey. I believe that everyone has their own way. I don't think that any one person should adapt to a way that does not feel right or comfortable for them. But without a certain level of uncomfortability, there will be no growth. So some of these groups and some of these sessions, we might get to some uncomfortable things, some uncomfortable questions. But when you start to feel uncomfortable, you can tell me that. And we don't have to cover those topics. But when it comes down, sorry, those clients are so loud. But when it comes down to it, the main goal is for me to be of service to you and to help you walk through this journey of recovery. And when we get to the other side, we'll develop an aftercare plan. If you wish to continue treatment, if you just would like to get to the point with the DUI and the mandated court stuff, if that's your end goal, I can help you get there. I firmly believe that as you move through this program, that you'll start to have, as I call it, a spiritual awakening. Some people call it like a realization or the aha moment. But basically what will happen is you'll start to develop some tools and see some things. And that's very easy to do when you're in the clinical setting. However, when you leave here, it's going to be important to have a way to put those tools into practice. I'm not going to tell you can control your drinking. I'm not going to tell you that this is a cure-all. Unfortunately, statistics say that a lot of people don't make it through recovery. And once they get out there, they don't apply the tools to make it. So that's why I do my best to structure a plan based on learning who you are through the counseling to help you once you get out of here. Right now you'll be in PHP for the 3 weeks, but after this, if you wish to continue in IOP, we can do that. It's less invasive. You come in from home. We do it 4 days a week instead of 7. And then the next level from that is OP. And you come in, I think it's an hour, 2 hours a night and attend groups. This will allow you to develop a relationship and a rapport with the counselors and the people that facilitate the groups. And some of those clients will progress through each of those levels with you. So you can develop relationships, friendships with some of these people. Another thing too is once you're completely done with the program and you have a lot of these tools and other things, I would strongly suggest a 12-step fellowship, because there you will get to meet people and you will get to work with a sponsor. They have events, they have dances, and they do a lot of fun things. And they don't use any substance. And that people can actually have a lot of fun while all this is going on.
It just sounds so
Foreign.
strange and foreign to not have alcohol in my life.
So it really isn't just for a day kind of thing. Don't focus on the rest of your life without it.
Yeah.
When it comes down to it, just make it from pillow to pillow. Just for now. If it starts to make a change as we go forward with the counseling, let me know. If it feels like it's really not working for you, let me know. But all in all, I think we can reach a level of resolution where you'll be a lot happier with how things will go. And like I said, I tell everyone I have great faith in you. I firmly believe that you can make it through this program and continue your life. And just have these tools. Like when you start to learn some of these things, I call it the turning on the light. Because sometimes people come in and they're in a down kind of place, and by the time the first 3 weeks is up in PHP, they're raring to go for IOP. And you see this light come on, and you see the joy. It's a beautiful thing. I'm not gonna give you any spoilers, but as you go through it, you'll see how it gets. You're on an amazing journey right now.
Okay, I feel like I can trust you. I feel like you are explaining it, in a way that makes it, appealing to me. I feel like I'm able to see myself doing something like that.
And like I said, it's just a day at a time. Just be patient with yourself.
Yeah, I appreciate that. I appreciate you and taking the time today to sit with me and just talk with me and listen to me.
Absolutely. Well, it was very nice to meet you.
You too.
May I
Nice to
shake
meet
your
you.
hand?
Sure.
All right.
Thank you.
You have a great day.
You too.